Hello friends. In this video, we are going to discuss about meningiomas. This is again another primary adult brain tumor, and probably as an isolated entity, this is the most common primary brain tumor in adults. Now, these are usually benign. They are found more commonly in females than males, and usually adult females. Okay. So it is common in adults, and females are more commonly affected than males. And usually they express the progesterone receptor also. They express progesterone receptor. Now, what is the significance of this? So during pregnancy, the size of meningiomas will increase significantly because they have this progesterone receptor. And after pregnancy, again the size will reduce. They originate from arachnoid cap cells. Or otherwise known as the meningothelial cells. Meningothelial cells. So what is the risk factor? So risk factor is prior radiation therapy. So prior radiotherapy, this is one risk factor. And the most important genetic factor that we have to remember is the 22q region deletion. So 22q, which encodes NF2 gene, which contains this NF2 gene. It is most commonly affected in meningiomas. NF2 codes for Merlin. It codes for the protein Merlin, and NF2 is mutated in neurofibromatosis type 2. However, even if the patient doesn't have neurofibromatosis type 2, still the patients who are having meningiomas can still have NF2 gene mutation as an isolated entity. They are usually extra-axial in nature, so they are extra-axial. Extra-axial, that means they are present outside the brain parenchyma. As you can see here, this is a meningioma, and this is present outside the brain parenchyma. As you can see, it is compressing the underlying brain parenchyma. And it has a dural base. So this is otherwise known as the dural tail sign. This is the radiological feature of meningioma. Now, these are benign and these are slow growing. Usually they are asymptomatic. But sometimes they can present with seizures and other focal neurological deficits because of compression of underlying brain parenchyma. In the histology, we will find one very classical feature, that is Psammoma bodies. So these are concentric laminated calcifications. So you can see here, these are concentric laminated calcifications. So these are all the important features of meningioma.